Christian Allgood, welcome to the Flipside.
Hey, how's it going?
It's going well. It's good to see you.
Me too.
We're gonna start off this by me giving a little bit of a background for you. Correct me if I'm incorrect about any of this stuff, and then we'll get into our conversation that we're going to have today.
Okay.
All right. So for all of you listening, Miss Christian Allgood here is a restorative wellness practitioner, a functional nutritional therapy practitioner. She's also a certified AIP coach. For those who don't know AIP, that's autoimmune paleo. She's a certified coach for that and a frequent speaker on their circuit for their seminars. And for purposes of being totally upfront about everything, she is also a lead head coach, training coach for the Pompa program, of which I am also a coach at that program. So we know each other through that. Is there anything that I missed out on that? Esthetician, licensed esthetician.
Yes. And someone that has lived with Lyme and gum infections.
Well, and that gives you a good perspective on it because you've actually dealt with it directly yourself. So our topic today is going to be Lyme disease. It's funny because it's something that I've never really thought much about, you know, until I started coaching for the Pompa program. I never really probably thought much about it. I knew about it, right? Because from doing functional medicine myself for so long, I knew about it, but I never had anybody come into my office that I knew of, right? Because there's lots of
Right.
hidden stuff that I knew of that had it. And I didn't even know anybody personally that had been diagnosed with it. And so until I became a coach at Pompa, it was just this thing in the background. Now, it seems like half the people coming into the program have a past history or a history of Lyme disease. So it just seems kind of crazy. So why don't you start off by telling me a little bit about your background coming into this? I gave the highlights, but just tell me your story of how you got into health, how you got into this profession, and then how you kind of became your own expert in Lyme through personal experience and training.
Yeah. I started my career as an esthetician working in a spa room. And also, my husband and I had an aquascaping business where we took care of these very large saltwater aquariums at doctors' offices and at restaurants. And, you know, the tipping point was when I was about 30, but really I started presenting with a lot of different symptoms at 25. And it started with, chronic migraines, severe eye pain. By 28, I was told I was going blind and put on glaucoma medication, and then the heart issues started and they couldn't figure out what was going on. They said I had mitral valve prolapse and that was about it. And
What
then
was happening with that? I mean, what were you experiencing?
I was having a lot of just palpitations and tachycardia, to the point where I was just really fatigued, right?
It's gonna
And
be
so,
scary at 30 years old.
oh yeah, I was before 30 with that.
Yeah, that's
And so it was
scary.
like just this cascade, right? That started with the migraines and the severe eye pain, being told I was going blind. They thought I had a brain tumor. Then it was, the MRI is clear, it's pseudo tumor. We need to do a spinal tap. And then, had a complication from the spinal tap, had a spinal leak, and had to get a blood patch done, which was very traumatic, very painful. Um, and then the heart issues started, then the digestive issues started. And then at 30, I wasn't able to take care of these large aquariums. It was a lot of physical work, something that would normally take me an hour, started taking 3 hours. And then it went into this full blown body pain, especially like in my jaw, and I couldn't eat, just extreme fatigue. And at that time, I was then diagnosed with myofascial pain syndrome, and a few weeks later, Hashimoto's. And it was just one of these things where here's your meds, this is the rest of your life. And completely got to a very dark place, lost hope. I became suicidal because, when you're reading this stuff that these conditions were lifelong, and all I could think is, I can't live another 50 years in this extreme pain. And so, anyways, by the grace of God, just probably a month or so after that, we found mold in our home, and which was really weird for being in the desert, right? It's not humid there. And so we went to Home Depot, bought a test kit, got it sent in, and, started looking things up on mold. And it was, everybody in the house was affected, dealing with different symptoms. And, it was with that, we moved in with my in-laws and, got insurance involved, remediation, all these things. And that took almost a year with dealing with them to get our house fixed. We did have Stachybotrys, which is the toxic mold. There's a lot of molds are toxic, but that is like the dreaded black mold that really, really can make you sick, along with a handful of others. And at that time, once the house was fixed, I didn't want to move back in. I was like, I don't care what the air tests say. I'm not moving back into that house. And so we moved to the coast of Oregon, not realizing it's full of molds. And it was at that time I was like, oh, we're going to Oregon. I had already been seeing a nutritional therapist and going to the chiropractor, and thought going to Oregon meant I was going to have all these holistic modalities open for me. And we moved to this little rural town on the coast of Oregon that had no holistic health services. And so during that time, I was still really struggling with my health. I have 2 small kids, and had gone to the doctors, for an ultrasound on my thyroid with the Hashimoto's. And when I went in for the follow-up, they let me know, you have some nodules, you're high risk for developing non-Hodgkin's lymphoma. And it was like, at that point, I was already taking tons of medications for different things. Like I had a gallon Ziploc bag full of prescription medications. And I remember after that, I'm trying to keep it together, walking to my car. And I get in my car and I just start screaming and crying and like hitting the steering wheel, because I'm just getting worse. I'm not getting better. And it was at that time I decided, you know what? There's no holistic people here. I'm going back to school. I'll figure this out myself. And so really it's been that journey for almost a decade where it seems like you're just learning and learning. You never stop learning, especially with the body and these different illnesses and infections. And so, I did AIP while I was in nutrition school, and I was able to get off my pain meds, which was awesome, but I still had a lot of different symptoms going on. And it really wasn't until almost 6 years later that I was diagnosed with Lyme. And so when we look at Lyme, I was the same as you, even up until a few years ago when I was diagnosed. I thought it was rare, didn't really think, oh, I don't need to learn about that. I can send them to someone. And now looking back at my health history, my symptoms were screaming Lyme and co-infections, even down to the migraines and eye pain. And so what happened to leading to my diagnosis of Lyme was my daughter got very sick in 9th grade and kept going back and forth to the ER, urgent care. And what were we hearing? The labs are normal. And it was like, this kid is very sick. Like, she can't even walk. Like, what do you mean? And so they gave her amoxicillin, and I was like, and I hated the idea of giving an antibiotic when we don't even know what we're doing. We didn't find anything, but I was like, you know what? We'll do it for a few days and see. And she actually started to feel a little bit better. Well, once we stopped the antibiotics, what happened? Now we're feeling really bad again. And so, at this time, we're living in Tennessee, and I find a functional medicine doctor, and we're seeing them and still running tests. We're not finding things. And then again, it was a God thing. I'm talking to someone about what's going on with her, and this person tells me, it sounds like Lyme. Again, didn't know anything about it, right?
And this is after you had been diagnosed, right?
No, my daughter's diagnosis
Okay.
led to my diagnosis.
Gotcha.
And so I was like, so I start looking things up on Lyme and co-infections. I'm like, okay, because Lyme is called the great mimicker. It can mimic a lot of things, and that's why it's underdiagnosed. And so I go to the functional medicine doctor. I'm like, can we test for Lyme? So they do a Lyme panel with the co-infections. And at this time, we had gone to like a rock concert with her that had a lot of flashing lights, and we didn't have test results back yet, right? And she almost was having what looked like a seizure, but she was conscious and aware, and she didn't know what's happening to her body. Her body was just freaking out. And so we go to the ER, and they drug test her and do all this stuff. I'm like, this kid is homeschooled and with me like all the time. Okay. Anyways, they didn't have any answers. And then after that, my husband and I were just sitting out at the lake just to like ground and get some peace. And we get a call from the doctor's office and they tell us it's Lyme. And we just like look at each other with like tears in our eyes. We're just like, okay, okay. And in my head, I'm like, okay, I work with people with all kinds of chronic conditions. I got this. Like, we know what to do. Well, about 3 days later, my system crashed. And I think it was from the stress and emotional, upset from hearing that your child has this disease. And I then ended up in the ER about a month after her with the same issue where I lost control of my body and I was having a seizure, but I was conscious. And it was just one of these things, it was basically I was having a POTS episode. My blood pressure had gotten too low. I wasn't getting blood to my brain, and then had a lot of cognitive issues for about a month and a half after that. And it was then at that time I went to the doctor and I was like, I need you to test me for Lyme. And mine came back very high levels compared to my kiddo. And that's where I really just started diving into the research of it. And yeah, that's basically what led up to this point.
That that is a pretty amazing story. And that sounds like hell on wheels, that's kind of crazy. Now, the mold, you were living, you said in the desert. Okay. Then you also talked about Oregon and then finally Tennessee. So I'm going to assume that you both got your Lyme while living in Tennessee then.
No, no.
That's the interesting thing.
Right. And so that's the thing, right? There's this misconception that Lyme's only in certain states and that it's only ticks.
Right.
Right. So Lyme and the co-infections can be passed in utero. They can be passed sexually.
Sexually. I never knew that. Interesting.
Yeah.
Sexually. Okay.
And so when I really start looking at my family health history and looking at my mom's health and hearing her health history, I truly believe that my mom was patient zero and gave it to me. I gave it to my kids. Both of my kids tested positive. And it was just one of these things because I'm like, I didn't get bit. I didn't have a bullseye rash. All the things that people think.
Right. Right.
And so, my mom had lived all over the country prior to having me in her late 20s. But there's some key parts of her health history that I'm like, yeah, that really screams infection right there. And then the things that she's dealt with fibromyalgia and other things. And so she hasn't been tested yet, but yeah, I really think that that's where this has all started for me and my kids.
So that brings up a good point that we can just kind of go off on our first tangent with is some of the misconceptions about Lyme. You mentioned the bullseye rash, and I know from statistics, and correct me if I'm incorrect on these statistics, but it's only 30 to 40% of people that actually have bullseye rashes. Is that correct?
Correct. About a third.
So 60 to 70% people are never going to see that. And that's what they usually use as, well, I never saw the bullseye rash, so I must not have it, right?
Right. Or that's what doctors will use.
Right. Yeah.
You can't have a bullseye rash. And that's where the gaslighting comes in and, not being educated properly on this.
And what are the other vectors besides? So ticks are the ones that everybody looks at first. And then we'll come back to the passing it down, because that's totally, I didn't even realize that at all in the sexual part. What are some of the other vectors as far as animals or insects?
So fleas are another one. And so when we look at that, my mom was a dog groomer and got bit by fleas all the time, right? Again, before she had me. But she remembers her health going down at a certain period before she had me or got pregnant with me. And then, mosquitoes are also one that's thrown out there, even though recently there was a study that was like, oh, we infected the mosquitoes and did these tests on mice and none of them got it. And so it was almost another gaslighting thing. Like, no, that can't happen. But we know that studies are a little subjective and there's a lot of variables. So those three really. So it's not just the ticks.
Interesting. And so I'm going to go ahead and pull up an image because this is one that I found. This image is a map, and you've seen these a million times. Anybody who's really looked at Lyme has seen something like this. Okay. And
Yeah.
so, we're looking here. This is CAPC, which is Companion Animal Parasite Council. This is their 2025 annual pet parasite forecast, and they're looking here forecasted prevalence of Lyme disease, and it fits exactly the profiles that we all think about, which is the Northeast, going into the Midwest. And so all this red and yellow is the areas where, hey, if you live here, you're kind of screwed. you have a high prevalence of Lyme, and if you're in the blue zones, then you're probably safe. But what you're saying is that, if this could be passed down, so would the original person have to have been bitten by a flea or a tick as the ground zero for them, but then they could also then pass it on?
Right. Yeah. But
So
then when we look at then people getting it in utero and then passing it sexually, just how wide that can spread throughout the population, right?
and is it female to male, male to female, goes both ways sexually, or is it
Yeah, both
ways? So it's in the semen.
Mm-hmm.
Interesting. Very interesting. Very interesting. Yeah, I looked at this because, I was born just outside Houston, Texas.
Okay.
And I was in the woods constantly from the time I could toddle to the time I decided I was done hunting, which was probably around 16 or so. I was in the woods constantly, and I can't even count the number of ticks I pulled off my body. My dad used to light a match and put it next to the tick so it would let go, right? Because if you tried pulling it out, it would leave the head behind, right? So, that plus we lived with dogs our whole life. I had fleas all around me, but that was in Texas. And so I worried about that when I first started thinking about Lyme. I'm like, damn, I'm the one that's screwed. I've had so many ticks on me in my life. There's no way I can't have Lyme, right? But then I went and looked and it said the first confirmed Lyme case in Texas, confirmed, was 2000. No. It was I want to say it was like 1988 or something like that. 1988 or something like that. First confirmed case. And at that point, I was done being in the woods as much as I had been. I was over that for a couple of years at that point. So I'm like, okay, well, maybe I'm still safe, right? Maybe I'm still safe. But now you got me freaked out again. So thank you very much for that. I appreciate that.
I mean, the one thing to remember about the Lyme and co-infections is that they're opportunistic, right? So depending on someone's terrain, their immune system, there are plenty of people that have contracted it that may never present. Their immune system is strong enough to keep it in check. It's one of these things where, mold is a big one. And I think that's really where our bodies were hit. We lived in a home with toxic mold for 4 years, not knowing.
So you're saying that weakened your system.
Right. And so that's the thing that we'll often see is mold and Lyme together.
Interesting.
Right? Or even things like Epstein-Barr virus, these things that can really wreak havoc on the immune system. And so it's not that just because somebody got bit by you got somebody that's been bit a whole bunch of times like yourself, never present, right? You can probably test, it might show it, but you're not going to actually, become very ill with it. And so that's the thing to remember. It really is just opportunistic. It's a stealth infection. So that's a lot of the problem why, people are getting misdiagnosed is that even the testing has this high rate of false negatives, even when you do a functional lab on it.
Is it a blood test?
So typically it's a blood test. There's also a urine test.
And what are they looking for? What is in that urine test that they're looking for in that blood test? Is there an antibody that they're looking for?
Yeah. So with the blood test, they're looking at antibodies for IgG and IgM. And then within that, they're also looking for bands. So kind of like, a fingerprint of these different bacteria. And so according to CDC, uh, you have to have so many bands of either IgG or IgM. The problem is, and then they want all these different numbers. But that's where things get a little bit tricky. So a lot of like Lyme literate doctors don't agree with that strict rule that the CDC set up, and it hasn't been updated in years. And so really what they look at is, does this person have these certain band numbers, and are they presenting with symptoms? And so that's why it's really important to see a functional medicine doctor that's Lyme literate, because typically, even if it's negative according to CDC standards, if you're carrying these certain bands and then you're presenting with the symptoms, they're still going to diagnose you with Lyme.
Sounds like the symptom profile is one of the bigger things. I mean, a lot of people in society think that tests are the holy grail. Like if you have to do tests for everything, and that if you don't do a test, you don't know. And so, they have a one track mind focus on testing. And I like labs. I respect labs. When I was doing lots of functional medicine in my office, there were lots of labs that I did like to use. But I also felt, even from my own experience, that there were a lot of times all I had to do is just look at their history. Just look at the history and look at the symptom presentation. And it was more than enough. And then I could do a lab to confirm it, but that's all I was doing. And I would often tell my patients that, we can do a lab if you really want to see the numbers. I'm clear that I think this is what it is. And so it's your money. If you want to spend the money on the lab, I'll get the lab for you to do, and we'll confirm it. But I'm telling you that I'm 99% right on this. It's going to come back as this. So I get that, and I would imagine too, but that especially if the test is focused around those immunoglobulins, that there's lots of different things that could make that stand out, not just Lyme. So
Right. Yeah. There's other bacteria that could flag it. So that makes it a little bit difficult. But then we also have to take into consideration someone whose immune system is so suppressed that there's not antibodies. So that's another problem.
Interesting. I didn't think about that. Yeah. Yeah, absolutely.
Like if your body can't put up a fight, then what?
Right. Because that's just the response of your body's fight is what we're testing there. So yeah. Oh, interesting. Yeah. Interesting. Yeah, I didn't think about that. I didn't think about that. That's very, very accurate. Uh-huh. One of my big things with the flip side, and I'm gonna have to come up with a way of phrasing that's marketable, but as like a tagline. But one of my big things with the flip side is being able to spotlight alternative practitioners such as yourself outside of the medical system. I respect, let me be clear, this is on record now for the camera. I respect the medical profession and medical doctors for what they do and for their education. The problem, in my mind, is number one, society puts medical doctors up on a pedestal that is not that they are not worthy for that pedestal, and that the entire system, for the most part, is about symptom management. It's not about health. It's not healthcare. Healthcare is the biggest oxymoron that exists. It's not health. And that the people, from my experience, that have the best knowledge regarding actual pursuit of health have been the alternative practitioners. And I don't like the word alternative, which is why I got to get another word, because alternative just means it's another way of doing the same thing. And we do not do the same thing as medicine. So it's not technically an alternative, but practitioners who do holistic approaches like yourself, like myself, that's really where health direction is.
Absolutely. Yeah. Like with, allopathic medicine is great for acute care, not for chronic illnesses that are going on, right? Because then it just becomes sick care. And the other thing that's hard too, as I'm sure you've seen, is with some holistic or alternative practitioners, doctors, is they actually almost do what allopathics doing, only just with supplements. And they're still not getting to the root, right? And so that's where we got to be a little bit careful, right? I've seen those type of people myself in my journey. Um, and so there is that, right? Like if I get in a car accident and I'm bleeding out, please take me to the hospital.
My analogy, I would do this in my seminars in my office. I would say, if I walked out the door right now and got hit by a car, I'm not going to have them rush me back into my office. I'm going to say, take me to the emergency room, make sure that I'm not going to die, even give me drugs if I have to. That's fine.
Right,
But then as soon as you do that, get me the hell out of the hospital, because that's not where I'm going to heal.
right.
That's where I'm going to then pursue other things. And you brought up a really good point. This is one I bring up with clients, patients all the time is, when you're looking for a holistic practitioner, a lot of people will go to a functional medicine doctor. I'm a functional medicine doctor now. You're a functional nutritionist. These functional doctors, there are a lot of medical doctors who are now going into that realm. And so you have an MD who is a functional medicine doctor. But the problem with that, and this is not going to be the 100% of the case, so don't get me wrong, there's going to be some that totally go the opposite of what I'm going to explain. But the education and training of a medical doctor is such that it's very difficult for them to go outside of that training. Even if they now call themselves a functional medicine doctor, the root of who they are and what they're doing is still Western medicine. And so
Yep.
they look at you as a functional medicine doctor with that degree through the lens of their medical training. And it ends up being giving you, hormones, or, and other medications and maybe some herbs, but they do it in a very medical way. So if you're going to a medical doctor who's a functional nutritionist or a functional medicine person, you are just basically getting a holistic version of Western medicine and not necessarily really holistic.
Mhm.
Would you agree with that?
Absolutely. I mean, I can't tell you how many doctors I saw, whether it was medical allopathic or functional, naturopathic, whatever, that why did I have to ask to be tested for Lyme? You know what I mean?
Yeah.
So it is one of these things. And it was the same thing, just, oh, running just basic labs. Here's your supplement list. It wasn't any different to me, you
Right.
know. Um, and I think that is something to keep in mind is you're right. You have medical doctors that then go and maybe take a week course and are able to call themselves a functional medicine doctor. And then you have those that do the, more advanced training. And it's just one of these things that, and again, same as you, respect to them and what they do. But unfortunately, the way that their education's been set up is for sick care. It's not for getting to the roots. And that's where, we're actually going to see the healing is we need to find the root and address it, remove it, and then give the body the nutrients and things that it's going to need to heal instead of just, here's another pharmaceutical to manage your symptoms.
Yeah. Playing patchwork. Yeah. And that's what I call that, like throwing supplements at things. Um, there was a study, and I wish I had where the study came from. It's very, very recent. It came out, and actually, I don't even think it was more like a poll as opposed to a study. And it was the medical doctors saying that they're so tired of people coming into their office asking, demanding root cause. And that these medical doctors in this article were saying they're so sick of people asking for root cause. And I'm like, well, there you go. That makes total sense. And it really is endemic of the problem, because we do need to get to root cause. And if you're tired of patients asking for root cause, you need to look in the mirror. You're the problem, right?
Right. Right. I think,
Yeah.
the hard part is that when you go to school for something and you believe in it and then it gets questioned, it's an uncomfortable place to be.
Yeah.
Like, well, so did everything I learned, was it a lie? And not that it is, but when we even look back in history and what's happened over time with, chiropractors and naturopathic healing, and going back to like Rockefeller and the Flexner report,
Oh
like,
yeah.
you know what I mean? Like the fact that this was all pushed out and said to be quackery. but we know that's where people actually get healing and start feeling better.
Yeah.
You
Have
know.
you ever heard of Wilkes versus the AMA?
Mm-mm.
This is you can find it easily enough if you do a search for it, but it's not something that gets talked about. There was a chiropractor named Chester Wilkes, and I don't remember the exact date. It was probably 75 or 76. He decided he wanted to sue the American Medical Association for and the exact wording of the lawsuit I don't have in my mind, but it was essentially basically saying that the American Medical Association was organized against the profession of chiropractic, and that they were doing lots of things to try to suppress and destroy the profession of chiropractic. So he got a few other chiropractors to go in with him and sued the American Medical Association. It took until something like 1989 to finally come. It took forever. It took over 10 years. It went to the Supreme Court, and the Supreme Court ruled in favor of Chester Wilkes and the chiropractors and said that, yes, you are correct, that the American Medical Association has been conspiring against the profession for decades.
Wow.
Not just and the ways they were doing it were so subversive. It was in the medical schools, making sure that what they were being taught, the upcoming medical doctors were being taught that chiropractic was quackery, that there was no science behind it, and to basically denigrate it in the schools as a beginning point. They were also telling doctors that you couldn't be part of the American Medical Association if you associated with chiropractors, if you referred to chiropractors. And they put out articles and research things, and it was very well organized. And
Wow.
so there was an explosion of chiropractic in the late 80s into the 90s. And we were allowed finally to get into Medicare, and we were finally allowed to get into the military. And that was after that lawsuit. Now, I don't think that stuff stopped. I think it became more subversive.
Oh, absolutely.
Yeah,
Yeah.
but that's a perfect example of what you're talking about, and this is what the medical profession does with anybody that talks differently than they do and promotes something outside. I mean, look at the attacks on supplements.
Right.
That's been going on for decades, but you have these peaks and valleys where they do legislation and they try to go after supplements really hard to try to medicalize it. They medicalized fish oil. Now you have prescription-based fish oil, right? So they try to get their hands on it and control it. So
I mean, just in the last few years with COVID, they were trying to do that with vitamin D and NAC.
yeah. Yeah, ridiculous. And it made me think when you mentioned myofascial pain syndrome, I kind of had a little chuckle because not at you, but these syndromes, myofascial pain syndrome, fibromyalgia. I mean, they like to create these syndromes and these labels when all that really means is I don't know what the hell I'm talking about. I have no idea what's going on with you. I really have no clue. You have pain that seems to be in your connective tissue and your muscle, so we'll call it fibromyalgia, that type of thing. They just throw out something. They have to give it some kind of acronym or lettering so that they can then start giving you drugs. But otherwise, they have no clue what's causing it, and they really don't even seem to want to know what's causing it. They just need to have some kind of label so they can throw medications at it.
And maybe, part of it is they're not taught to be curious as to the cause or the why. It's more or less just here's the facts, this is what it is, and then here's the medication.
Yeah, I'm sure that that's a big part of it. Well, this is me. I get into you start talking about something like that, I'm going to go down the rabbit hole because it's one of my biggest pet peeves. But let's get back onto Lyme. I want to know, if you can, the list of symptoms that people present with. So speak to those listening right now. What are the things that they should be looking for symptomologically, presentation? How are they presenting? What would it look like if I have Lyme XYZ?
Right. Yeah. So one important thing to understand with Lyme is sometimes when we're talking about Lyme, it's kind of like a catch-all term for Lyme and its co-infections, because I don't know that Lyme is ever by itself, right? There's a lot of co-infections that can come with it. Again, mold can be in there, Epstein-Barr, cytomegalovirus. And so symptoms can look different person to person. I will say anyone that has been diagnosed with some type of myalgia, fibromyalgia, myofascial pain syndrome, those kind of things should be tested for Lyme and its co-infections. Other people that we have seen that really should be tested is like MS. So Lyme can actually cause lesions on the brain.
Interesting.
A lot of the symptoms that we see in MS, we see in Lyme. And so it is important for those people. Other times that people should, investigate is with psychiatric. So bipolar disorder, schizophrenia. So it's really one of these things that it can just affect everything, right? So obviously like fatigue. Well, we see fatigue in a lot of autoimmune and other chronic conditions, right? And again, remember that Lyme and its co-infections is known as the great mimicker. And so this is where we get a lot of misdiagnosis. Fatigue, migrating, muscle, joint pain, neck stiffness, headaches or migraines, brain fog. And so when we start to like look at those kinds of symptoms, that falls into all kinds of things, right? All kinds of autoimmunity, memory problems, difficulty finding words, mood swings. You can see light and sound sensitivity, insomnia, air hunger, or shortness of breath. We see the heart affected, heart palpitations, chest pain, dizziness, numbness and tingling, visual disturbances, then hormonal imbalances, digestive issues, uh, night sweats is a big one. And that one, is kind of hard when I hear someone has night sweats. Let's say if it's a woman, it's like, okay, well, are they menopausal? Let's rule that out. Mold can also cause night sweats. Cancer can also cause night sweats. So it's one of these things where you have to hear the whole picture. Swollen lymph nodes, and then even you have a co-infection called Babesia that is a parasite. So when we look at Lyme, it's a bacteria, but one of its co-infections is a parasite that invades the red blood cells. And so you might see some anemia, blood pressure issues, heart issues, temperature regulation, the fatigue, the same list, they're just a little bit different. And then Bartonella. Bartonella is a big one that is actually a little nastier than Lyme itself, and hard to detect, can cause a lot of psychiatric issues, OCD behavior, depression, suicidal ideation. There unfortunately has been people with Lyme and its co-infections that have taken their life. Electric shock sensations, twitching,
Wow.
uh, the eye pain, the migraines. Bartonella does have one symptom, though, that can really stand out, and it doesn't happen with everybody that's infected with it. And, Bartonella can be referred to as cat scratch disease because you can get it from a cat scratch. And that's where you get those red striations in the skin that look like stretch marks. And that makes it a little bit more obvious. So like even for my daughter in, this journey with her, has presented with that symptom. And so she had been doing really well for a while. And then in January got really sick again and was sleeping more. And I'm like, what is going on? And she was asleep on the couch and had her arm up like this. And I noticed the red streaking behind her arm. And I was like, okay, like we're going back to the doctors. And at that time, the Lyme wasn't showing as prevalent as before, but the Bartonella had ramped up. So that's just an interesting one. Yeah, I mean, there's like nowhere that it doesn't affect symptom wise. It invades the central nervous system, can get into your joints, your muscle tissue, your brain. Lyme itself, the spirochete is a corkscrew shape. So it really digs in and gets into places.
Where does it tend to hide in the body? I mean, is it everywhere, or does it, I mean, like if you think of something like the chickenpox virus, our body doesn't actually get rid of it necessarily. What it does is it I always give it if you think of like an old lion tamer with the chair and the whip, right? Whoosh, and
Mhm.
it's trying to get the lion to go back into a cage so it can lock the door. I used to always use that analogy for the body fighting off the chickenpox virus. It backs it up into a ganglia in your nervous system and locks it into that ganglia, which is why when we have why am I dropping the name of it?
Shingles?
When we have shingles, that the stress of the body and the dropping of the immune system unlocks that door so it can get out. But now it's trapped in that dermatome, and so it only comes across and shows in that one area because it was related to that ganglia. Does Lyme hide in a particular place, or is it all over the body?
It just goes everywhere.
Yeah.
I think how it presents will be just dependent on the person. Maybe if they have a weak point in their body, it might target that. But I mean, it can even cause what's called Lyme carditis, right? So that when I was first diagnosed, I was still having a lot of tachycardia and stuff. And so that was the first thing I went and did was get an ultrasound just to ensure that my heart hadn't been affected from having it for so many years. And thankfully that came back fine. But, you know, really we just see it invade the nervous system and the muscles and the joints, the blood cells. Another what symptom that is often seen with this is just low grade fevers. So for years, I would have these waves of feeling like I was getting sick with the flu because flu-like symptoms is very common with it. And I'd get feverish, I'd spike a fever, feel really crummy for probably 2 or 3 hours, and that would just pass. And then I'd feel fine. So, it's just, yeah, can cause nausea, no appetite, sore throat. It's just one of these things, again, why it's so hard for, I think, doctors, if they're not versed in it, to just think it's other things and testing for other things because it can sound like it's other things.
Yeah. And you're talking about other things. My mind is racing now because a thought is occurring that I hadn't thought about before. And that's because a lot of what you're describing is also a lot of what we see in long COVID.
So we can
You
go
know,
down that road.
yeah, absolutely. And because it's very similar to a lot we see in long COVID. And so I'm assuming, and I'd have to do the research on this too, but I'm assuming that what Lyme is causing is, at least in relationships, some type of cytokine storm,
Yeah.
uh, and that we're seeing a lot of that similarity as such.
Right. So yeah, there's definitely the cytokine storm that's playing a role, but one thing that a lot of doctors were speculating when we're looking at long COVID, is it possible that it is Lyme that has been activated and they're not
Right,
testing, or are we seeing a reactivation of Epstein-Barr virus and it's not
right.
being tested? So
Yes.
that is where, with the long COVID, those are two things that probably should be tested.
Yeah, that makes total sense. I mean, especially if we're saying that Lyme is activated by your immune system being in distress, right?
Mhm.
So if just simply even having COVID put your immune system in such distress, then that's going to activate these other things. So
Right.
it makes total sense.
Right. And I mean, if we
Wow.
think about that, you can carry Lyme for decades and it be fine. And then your body takes a hit. And now, that sleeping giant's woken up.
Yeah, and I saw a number on the CDC's website when I was doing a little prep for this, and it was close to 500,000 cases of Lyme that they predict, but they also said that the number could probably be much more than that because of diagnostic criteria not being accurate.
Yeah. The
So
actual numbers likely in the millions.
yeah, that makes more sense. Interesting. This man, there's some interconnections things that are going on now in my brain with that I didn't have before that are really opening up some fascinating possibilities. So because I'm already thinking about this, and you're gonna enjoy me opening the door for this. Um, let's go ahead and dive into because it was first brought up to the public, even though this is not something that's been hidden necessarily, but a lot of the public didn't hear any of this until Kennedy was grilled about this during his confirmation, with the senators trying to catch him in a trap, basically,
Right.
and saying things like, so you think this was created in a lab and as a government experiment, that it's been a plot to, so and I'll tell you, I didn't know any. I had heard little bitty things about that prior to that. I'd heard of that being a conspiracy, and I am putting that in quotes because we know, especially from our time during COVID, that conspiracies aren't necessarily conspiracies, right? So tell me a little bit of that. I know when I mentioned that I was going to let you talk about that, you were like a little giddy about that. So so
Right.
so go for it.
Yeah. So as I said, I am a researcher by nature. I'm curious. I have been since I was a kid. I love to investigate. And so obviously, when me and my kid got diagnosed with this, within a month or so of each other, research right away. And I came across this book called Bitten by Chris Newby. Um, she actually had contracted Lyme, her and her husband, and went down. And I can't remember, I think she's a scientific researcher and journalist. And so she really dove deep into this and actually interviewed Dr. Willie Bergdorf. Why can't I say his name? Bergdorfer, who identified Lyme in the 1970s. So in the 1970s in Lyme, Connecticut, all of a sudden there's all these like juvenile arthritis, people getting sick, they don't know what's going on. And Dr. Bergdorfer was the one that identified Lyme. And it ended up being named after him, the Borrelia burgdorferi. So there's that information right there, right? Um, so really evidence, suggests based on her research that, it originated earlier as part of US military bioweapons research. And that is going back to the Cold War. And so what's interesting, and she actually interviewed him before his passing. And I can't tell you how many times bad words came out of my mouth when I was reading this research. So when we really get into it, she was diving into like government documents, interviewing direct correspondence with this doctor. And what we found is that he had worked for the US military in biological weapons using ticks and other insects during the Cold War. So it would make sense that, oh, he would know what this was come the 1970s, right?
Right.
So he, had admitted on tape before his death that he believed that the Lyme epidemic may have stemmed from a military experiment gone wrong. And
Huh.
so, when we look at this, Lyme, Connecticut's not too far from Plum Island, where a lot of this disease research is done. And so, it was just one of these things that, they were weaponizing these insects during that time. And a lot of it was to create something that was silent and able to debilitate and go unrecognized, like you couldn't trace it, right? And this is why we call it a stealth infection. It's hard to find. And so with that, the whole thing would be, was it accidentally leaked or was it something more than that? To that, we don't know, right?
Right.
And it's not that it is one of these things that we're just making up. This research did happen. There are papers on it. And so with this, it was something that they were developing it during that time to push these weaponized insects out of airplanes over areas. And so even people that, were working on that project maybe accidentally got bit and then sick. And so there's reports of that as well. And so it's just one of these things that, I think is part of why maybe we don't have the information we should on it, is when you think of the liability and the public outrage that there would be, even, with COVID. And at first the speculations, did it leak from a lab? And they're trying to keep that under wraps. And then it was like, oh, well, yeah, it leaked from a lab, right? And so that's, where, accidental or not, we have this disease that can be spread in certain ways, and even that's not acknowledged. And the CDC, it was interesting, was it in October of 2023, finally acknowledged chronic Lyme. So for all these years, it was no such thing. And then just a few months later, they took that back. So I don't know.
Interesting.
Don't know what happened.
Huh.
But, I think it's one of these things that is like, yeah, it's not that it's a conspiracy, but I think the ramifications, if it was to come out publicly and acknowledged, right, versus just being said that, oh, that's just a conspiracy, the outrage that would happen because of how many people's lives are affected with it and debilitated by it.
That's the whole reasoning why autism is going to be such a difficult thing, because if they actually did acknowledge it, which, that's one I can speak of confidently. I don't know the Lyme one. There's more than enough evidence to back up vaccines being associated with autism. We won't say it's the cause of autism, because I don't even think it's the cause of autism. I think
it's the tipping point.
Yeah, it's the thing that typically turns a person who has a genetic predisposition and or other commingling factors. It's the thing that sets them over the edge and creates the problem. It's what starts the domino going for them.
Oh, absolutely.
Yeah.
Both of my kids are on the spectrum, and my oldest, and more like, high functioning, like Asperger's, but my oldest got a flu vaccine at 7 and was never the same kid. So it wasn't just like MMR that a lot of them are relating it to, right?
Oh,
and
yeah.
So it was at that time, he was sick. He was on antibiotics for bronchitis. We were living in toxic mold. It was just this perfect storm that happened in his body. He had severe physical reaction after the vaccine. And then once we got his body to calm down, his brain was not the same. His personality was not the same. And so, I think, yeah, he was predisposed, but then, definitely vaccine injured.
Yeah. The vaccines are, I'm not going to let myself go too down that that's a whole nother conversation. But that liability factor, I've been saying this for a very long time. This has been something I've talked about for a long time. If they would allow the research, I mean, think about William Thompson's research that was suppressed for that was what was talked about in the movie Vaxxed, right? That whole thing was about CDC researchers finding out in their research, this is confirming the autism connection. Okay, so then we have to change the statistical data to make sure it doesn't show that, because if it did show that and it came out and it was solidified, then there would be an outrage in public saying, you now owe us money for all these damages. It would bankrupt the system. It would bankrupt it like that. I think that if and when Kennedy is able to actually bring that to light, there's going to have to be some type of what do you call it when you don't have to pay? They would have to basically be able to say, yes, they're guilty, but they're not going to have to pay, because otherwise it would bankrupt the system. The system would just collapse. They'd have to do something like that.
Right. And I think it's the same along with like the Lyme information.
Yeah. I never actually knew that it was called Lyme because of Lyme, Connecticut. I didn't know that.
Yeah. Yeah. And that's one thing, like, I hate when I hear people say limes. I'm like, it's Lyme. Because especially when I hear a doctor say that, I'm like, okay, just so you know, people that are living with this disease will nitpick on that. It's Lyme, no S. But yeah, that's where the name came from, was, those first cases in the 1970s in Lyme, Connecticut.
Interesting. So we know that the symptoms are all over the map. I guess there's a kind of there's a central area from which we see a lot of the symptoms, but there's all sorts of different things. And the number of people that could be potentially infected with Lyme is far more than what we think. I am assuming, and I'm assuming this not knowing for sure, but that the primary medical approach is to do lots of heavy dose antibiotics. Is that the approach?
Yes. The problem is to the testing for allopathic medicine, right? So typically they're going to do a Western blot test that's really only looking for the Borrelia burgdorferi when there's actually many strains of Borrelia, and then they're not testing for the co-infections. And as I said, my daughter, her Lyme test just, it showed that, yeah, it's there, but the immune's not responding to it, where the Bartonella was like off the charts, right? Mm-hmm. So sometimes we can see the Lyme not really be so much of an issue, but one of the co-infections is, and they're not testing for that. And then, yeah, it's hit you with about a month-long dose of something like doxycycline. There are some people that end up having to have ports and do IVs that way long term. But when we look at, Lyme and its co-infections and just how stealthy and smart they are, that, they can evade these antibiotics. They hide from the immune system. They hide in biofilms. They go back into a cyst form that makes it where you can't touch them with antibiotics. It's just very complex. And, what I've seen over the years with clients is they'll put that they had Lyme, and I'm looking at all their symptoms and I'm like, this is looking like Lyme. Oh, no, I took antibiotics.
Right.
And so then they're led to believe that the symptoms they're having now, there's no correlation, when really
it's just not, just never got taken care of. How successful, in your opinion, how successful is the medical approach with the antibiotics? Do you feel like it actually takes care of it, or does it just scare it into hiding well enough to make you think that it took care of it?
Right. I think, let's say you're a healthy person, you find a tick on you, and that's one thing. Like if you do find a tick, send it in, have the tick tested. But typically if someone gets on antibiotics right away, they're usually good. But how often does that actually happen?
And how fast is right away?
I mean, typically within 48 to 72 hours is recommended, right? Most people, especially people that live in areas that have a lot of ticks. I mean, I'm sure you've heard it from a lot of clients too. Oh yeah, I got ticks on me all the time as a kid and this and that, right? Or same as you.
Right.
And so, that's the thing with the antibiotics, right? Is since these bacteria are so smart, when you go to start killing them and hitting them, they're going to go into hiding. They're going to revert back, right? And so then what happens is someone that maybe did a month-long course of antibiotics, they might feel better for a month or two. And then what happens? Starts coming out of hiding and we start seeing symptoms again. And so that's why it's so important with treatments to pulse it. So you hit it for a little bit, you back off. That way it thinks it's safe, and then you hit it again. Whereas with the allopathic, they just keep hitting it. And so we're not able to truly get it, because then it reverts into that cyst and it's hiding behind biofilms.
I was just going to ask you to explain what a biofilm is, because that's the same thing with parasites, right? Parasites and these bacteria, the biofilm is kind of their protective, place. So explain what a biofilm is.
Yeah, so a biofilm is basically a protection mechanism that these bacteria or parasites have, and it's going to make them resistant to whatever antimicrobials you're trying to use. And so a lot of times when we are dealing with an eradication protocol, we want to give a biofilm disruptor that goes in and breaks up that biofilm so that we can actually get that bacteria or that parasite. And so a lot of the way that I describe it is kind of like plaque. So when we have plaque, let's say on your teeth, your arteries, whatever, your intestinal tract, we're able to address everything that's on the outside of it or the front side of it, but we can't get what's behind it. And so that's why it's important that we do use biofilm disruptors so that we can get all of it. And I mean, often in GI clients, you know, we'll see like, oh, I've treated this so many times. And then you talk to them and, well, did they give you a biofilm disruptor? No. And they can't figure out why it keeps coming back. It's because we didn't get through that plaque layer to get what was hiding behind it so we could actually eradicate everything, right? So that's how I like to describe it.
Well, I'm assuming I know that, and I'm going to use the Pompa's version of this because I'm familiar with it. But in the Pompa program, for those who don't know anything about the Pompa program, it's an amazing program. Detox is the primary aspect of it, nutrition. But we have lots of different protocols. And in the parasite protocol, the idea is, number one, we do have the biofilm disruptor, but we're also attacking it with different killers in a cycle, so that we attack it with a killer and kill the ones that we can, but then understanding that it's going to go run and hide into the biofilm or somewhere else. And when it starts to lurk its little evil head out again, we hit it with a different killer, right? We're like, okay, yeah, wait for you to sneak around the corner. We're going to smack you down again. And then it runs and hides. And then we wait for it to come out and we hit it with a different killer. And so we're stacking different killers and biofilm disruptors to do two things: take away its hiding place and hit it hard with different ways of doing it so that it will get a more thorough cleansing. And I haven't looked at the Lyme protocol, but I'm assuming that the Lyme protocol in the Pompa program is probably going to be similar with that, but with natural antibiotics maybe.
Right. So, and that's the thing. So even when we're using like natural forms of like antibiotic, antimicrobials, it's going to be the same thing that can become resistant. And so that's why we want to make sure to switch it up each time we go into a hitting round. And so, the protocol at Pompa, we pulse on and off. And so you might do a 1 to 2 week cycle on with certain killers. You'll take a week or two off. And then when you go to another week or two on, you're going to use a different killer. And that way it doesn't become resistant to any of these.
What would be, and I'm not going to suggest that anybody out there watching this try to do this on their own. There are so many different variables. You really want someone who understands the variables well enough to supervise you through one of these types of programs. And so for everybody watching, if you do think you have this, don't just go take some oregano oil and think you've taken care of things. But I mentioned oregano oil. What are some other natural antibiotics that you might use in a protocol like this?
Yeah. So, some people might use something like silver. There's a lot of different herbal blends. I think, when we're looking at that, though, keeping in mind what all's going on. So there's definitely like Lyme protocols that are natural out there that you can find, but working with a practitioner that understands all these different infections, I think is important. There is, let's see here, written out a list so that we had those.
Good.
Don't know why I can't find it now.
Yeah, well, while you're doing that, I'll just mention something. I mentioned at the very beginning of the program, just in the ability to know conflicts of interest. I do work with the Pompa program as well as I have my own practice. Christian is also a head coach at Pompa. So this is not meant to be a marketing or advertising for the Pompa program. With that said, I will say that there are lots of excellent benefits with the Pompa program. There are lots of excellent resources. I talk about supporting the holistic community through the Flipside. Not that I'll never have a medical doctor on here. I would love to have some medical doctors on here who have the right attitude. I'll grade that. I'll be the judge of that. But the professionals that I have worked with the Pompa program, the coaches, probably some of the best health coaches in the country are working with the Pompa program. These are all really smart individuals very smart individuals. And I think the Pompa program turns a really good health coach into a amazing health coach, because you're kind of in the fire.
Oh,
Pompa
absolutely.
program's very busy, so you get a lot of practice working with clients of all sorts of backgrounds and major sick backgrounds. And
Yeah,
so it's
very
not,
sick people.
yeah, it's not a matter of it's a weight loss program, right? You're getting people, some of the sickest of the sick coming to do that. So you really get a chance to cut your teeth on some really hard cases. Yeah, for the Pompa program and the health coaches in the Pompa program. But go ahead. Did you find the information you wanted?
Yeah, yeah. So, I mean, obviously, first biofilm disruptors. So, like proteolytic enzymes on an empty stomach, cat's claw, Japanese knotweed, angiographis, cryptolepis, Purinia. I don't know if I'm saying that right.
Easy for you to say.
Chinese skull cap. So there's a lot of different herbal blends. And again, it depends on what's going on. And that's why it's important to work with like a Lyme literate doctor that understands what's going on in your body. What else do you have going on? And so that they can write a proper protocol. I wouldn't recommend anyone just like go follow just anything, because a lot of times, even heavy metals need to be addressed. Lyme,
Yeah.
those, and so you know, I would say, before even trying to kill any of these things, is first really, stabilizing the body, reducing inflammation using nutrition, looking at, do we need to address mineral and nutrient deficiencies? And then making sure that we're supporting drainage, right? We don't want to go start killing all of these organisms if your gut's in bad shape, if your liver's in bad shape, your kidneys, your lymphatic system. A lot of these infections can really bog down the lymphatic system. And so those are things that, I think are important to address before we just start killing. Other than that, a couple of things that I would recommend out the gate for somebody would be something like phosphatidylcholine. So like Body Bio's
Yes.
pea oil.
Love
So
that.
yeah, so Lyme and its co-infections really love those lipid rafts. They can steal from our cell membrane for its own outer membrane. So, your cell membrane is what's responsible for all the good getting in and the bad getting out. And when that membrane becomes damaged from all kinds of different things, especially these infections, we're going to start seeing a lot of problems. And so that phosphatidylcholine can be really great to help heal those cell membranes. The only thing with it is, it can be pretty potent. And so for someone that's very sick, starting with like maybe a quarter, an eighth teaspoon a day, and then working up over time slowly, to a teaspoon, tablespoon, because it can cause detox and herxing. And so that's where we want to make sure that, your drainage is supported, your liver and bile is flowing well. So, and also using binders to catch everything in your gut so you don't take it back to the liver and auto intoxicate. Um, Other things that you could start out with would be like PEMF, Rife machine, limbic retraining, like primal trust can be really helpful for people with Lyme.
Explain what that first one was. You said PDMF.
The pulse electromagnetic field therapy.
Okay, excellent. Gotcha.
Yeah. So those, those are, I mean, and you could really go stand on the earth and get some natural electromagnetic.
So like grounding.
Mm-hmm.
Yeah.
Yeah. But, as far as when we're looking at the different antimicrobials is, if you are working with a Lyme literate doctor, there might be some pharmaceutical drugs that are also going to be involved alongside some herbals. And so again, it really just depends on your case.
I'm curious with the Western medical approach, which is basically just to bombard the body with really strong antibiotics, right? And multiple layers of it. We already know, well known, that these antibiotic bombardments can destroy the gut lining.
Yeah.
And so if a person is going through this approach and bombarding their body with heavy dose antibiotics, I wonder what the percentage of people are that end up not only still having Lyme because it wasn't cycled with different types of things, right? And so they still have the Lyme, but now they have a destroyed gut lining and a destroyed microbiome, which means that once they get over the initial, oh, I'm better because they've hidden themselves. How many of those people now have a far worse scenario at the end of that? And like you even mentioned yourself, you're like, oh yeah, I had the antibiotics, so I don't have Lyme. What I'm experiencing now can't be Lyme because of that. But it very well could be, really bad Lyme now because it actually made it worse in the long run.
Right, right. Yeah, because when we mess up the gut, we mess up the immune system more.
Right. Right.
So,
You don't have the resource, and you've opened up the gut lining to make it even easier to become more inflamed and allergic and responsive. And so you've got all sorts of things to set that cytokine storm up, right?
right, right. Now we're seeing food sensitivities, reacting to everything. We start to see mast cell activation in these
Oh,
people. And, where then, cell danger response, where now, even if you are introducing something healthy that your body needs, you're reactive. And so that's where, like the limbic system retraining has helped a lot of people. And sometimes what it is, you have to go really low and slow through some of these protocols because the herxine that can come with killing Lyme and its co-infections can be pretty intense.
I my brain's working with clients that I've currently got right now, and now I'm thinking about clients that I have with their situations and thinking, I think I need to go back with this person and do another little investigative conversation with their situation. Um, yeah, yeah, interesting. My brain's going a million miles an hour now. Um, what was I going to ask? With diet, now this could be a grab bag as far as the answer here, because there is no one diet fits all for anybody really. But with people with really serious Lyme, if they're having these types of reactions, and like you mentioned the mast cell activation syndrome, these histaminic responses, in this person, everything is setting them over the edge. Their system is so far to one side that they're reacting to everything. What would be a nutritional approach that you would use? And yes, we're being general, okay, but what would be at least a beginning direction?
Yeah, I would probably start with AIP, the autoimmune protocol, just because really what that protocol is doing is it is removing foods that are known to be triggers to the immune system, as well as foods that are known to degrade the gut lining. Because a lot of the goal is to calm the immune response and heal the gut lining. And so that would be a starting place with, maybe having to integrate some low histamine diet with AIP. Again, just depending on how reactive they are. In my journey, I was in nutrition school. There was a lot of this that wasn't taught on. I was doing AIP, and as the noise was getting less in my body, I was able to see that I was responding to foods that were allowed on AIP. So the high histamine foods, the minute I had banana, avocado, ferments, I went into tachycardia. And so I kind of was just like, okay, I can't eat these. And then, also dealing with gut issues, I had to do low FODMAP. Well, and then as I'm going through it, I found that for a period of time, I probably had 5 safe foods that I could eat.
Wow.
But it gave my body time. So it was more kind of a carnivore-ish diet that I was on for a period of time. But the whole point is to give the body a break from these responses from food. Because the thing is, even though a food is a health food, it might not be good for you.
Right.
And so, when we're looking at histamine issues and mast cell activation, That's another issue because those symptoms can be wide ranging. When we think histamine, people think sinus or hives, right? Where some people can have anaphylaxis with it. For myself, I went into tachycardia every time. And so the symptoms can be broad, right? I mean, the high histamines can cause headaches, anxiety, digestive issues. Maybe you have diarrhea or reflux, those kind of things that can cause muscle joint pain. And so, it is where when you go on an elimination diet, as the noise calms down a bit, you're able to really identify like what your body will tolerate. But I think a lot of it also is working on your mindset, because when you are in this heightened state of being ill, um, even with food fear can come in. And that happened for me. I developed orthorexia on this journey. I became fearful of any food that wasn't organic, grass fed, right? Like panic attack, because I had seen results. I was so fearful that if I ate anything off plan, that I was going to have a reaction. Well, when you're hyping your brain and nervous system up that way, you're going to have a reaction.
Right.
So, there's a lot of moving pieces to it.
When I gave, when I would do, I don't know if you know this about my background, but I'm not currently, but I've been a teacher for a big part of my career, and teaching anatomy, physiology mostly. And so in teaching digestion, I would always tell the students, I said, don't think that this is the beginning of your digestive. Okay, this is the beginning. This is really the beginning. So this isn't the beginning. This is where you think the journey starts, but the journey starts here between your ears, because if you're having digestive problems, everyone, the medical system says, oh, you're having abdominal cramping, so let's look at the abdomen. Right, you're having diarrhea. Let's look at your anus. I mean, they go right where the symptom is, and that's where they try to throw something, is at the symptom. But you have to start at the top and then work down. You can't start at the bottom where the symptom is, because that's not where the problem is. And one of the biggest factors that is overlooked is what you just brought up. And I always refer to it as sympathetic overload. You're in a rut with sympathetic nervous system stimulation. That's suppressing parasympathetic nervous system stimulation, which is what governs your digestive tract, which means now not only are your enzymes, acids all out of balance or even turned off, but motility is also affected. Okay. Hormones are affected. And so the entire cascade of parasympathetic responders in that system are affected because of the sympathetic stimulation. And that's exactly what you're just alluding to.
Yeah. I mean, and even when we look, excuse me, in terms of that, what is causing that sympathetic dominance, right? So it could be any number of stressors. It's not just like your mental, where you're thinking about things, but when we're looking at these stealth infections and other toxicities like mold and heavy metals that get the brain stuck in that sympathetic dominance. And so there's, it's where it needs to be holistic. There's a lot of pieces that need to be covered. So if we're eating the perfect diet and on the perfect supplement protocol, but we're not working on our mindset and our thoughts, we might not get very far.
Yeah, absolutely. If you're constant, it's like feeding the fire from a different direction. You can be feeding the fire with your nutrition, which is quite obviously a big part of that. You could be feeding it with physical exertion. Dr. Pompa always talks about part of his perfect storm was the fact that he was exercising extreme, which was tearing down his system.
Right.
And so we think of, oh, well, exercise is positive. Exercise is very positive, but exercise is still a sympathetic stress. And if your body can't handle that, it's part of that sympathetic overload now, and then the emotions, speak on that a little bit. How would the emotions be a factor in this? I mean,
right.
people like us, we understand the connection, but I think there's a lot of people that would think, what do my emotions have to do with this physical aspect or with this physical problem? What is that? How is that connected to that? Right.
Right. So even just our thoughts are going to set off a cascade of hormones. Right. And so if we are in the shower and you had this conversation with someone and you're like, oh, I should have said this, or I should have said that. Right. your brain thinks you're living through that situation again, right? So you have that piece. And then you have the trauma piece where someone ends up with PTSD and that HPA axis gets hijacked. And now the body is stuck in sympathetic dominance, right? And that just really, I mean, you have cortisol shooting out all the time. Now we have a lot of inflammation. Now the body's susceptible. And so that is where, again, all the things have to be addressed: mind, body, spirit, right?
Yeah.
So, I mean, with, trauma and, the high ACEs, the adverse childhood experiences, we see a lot of these people with chronic health problems. And so, really understanding how much our emotions are tied to our physical health, that our cells, our organs hold memory, even if maybe we don't remember. That's the other thing, like repressed memories. And so, there's a lot of different modalities out there now that, it's not, you have to go and talk through it, because I don't feel like that super helps. I went through 20 years of trauma therapy, learned some tools. Okay. Did not fix the PTSD, did not fix the nightmares and flashbacks. And then I found something called TRP, the Trauma Resiliency Protocol, which is a little bit like NLP, and had a breakthrough after one session.
NLP, for those who don't know, neuro-linguistic programming, right?
Mm-hmm.
Anthony Robbins, huge component of NLP. Yeah.
Yeah. Yeah. And, there's different things: somatics, craniosacral therapy. There's a lot of ways to help get these trapped emotions and traumas out without having to talk about it. And so, just that people know, like, because just the thought of having to go and talk through your trauma with someone is triggering. Well, then what's that doing to the nervous system?
The talking itself is actually creating the problem. I've always I think talking through the problems is important, but if that's the only thing you're doing, then you're not going to ever really get to the meat of the matter, as they say, because there's so much that is physically ingrained with those emotions. My thought has always been, you need a way to access the physical nature of that emotional experience. It has to be a physical process, not just a mental process. And the talking is just the mental process. There has to be a physical process too, which is why, what's the eye therapy? Rapid eye.
EMDR.
EMDR. Thank you. EMDR works really well. There's lots of other ways that this goes about. You mentioned, excuse me, fibromyalgia earlier.
Mm-hmm.
I did a lot of work with fibromyalgia during my functional medicine career, and I gave some fairly big talks with audiences on fibromyalgia. And my thought process with fibromyalgia, I pretty much every patient that I saw with fibromyalgia, there was some type of physical trauma and there was some type of emotional trauma that happened in a very close proximity of each other. And so it may have been they were going through a nasty divorce, and they had 2 months later they had a car accident.
Right.
But something like that. There was some kind of emotional traumatic event and physical traumatic event that kind of seemed to coincide to create what Dr. Pompa would call the perfect storm, right? You got to have those three or things coming in. And
Right. It's
so
never just one thing.
no, it's not. But with fibromyalgia, especially, very few people that I saw with fibromyalgia did not. There were very few that did not have some type of emotional traumatic event. Almost across the board, there was an emotional traumatic event involved, along with whatever else. But that was like one of the central key things, one of the central key figures. And when you think about sympathetic stress, if you're in sympathetic stress all the time, you're not in parasympathetic, and your body heals in parasympathetic. And
Right.
the longer you're in sympathetic, you've got breakdown of fascial connective tissue, muscle, joint, etc. So therefore, you've got fibromyalgia, you got pain in the connective tissue, in the muscle tissue, due to that sympathetic stimulation without the parasympathetic healing.
Right.
Yeah. Ah, good stuff. All right. We went over the symptoms for Lyme. We went over a little bit of the conspiratorial history. We went over a little bit of the protocols. Give me what you would say to people. So if there's people that are watching this right now and they're like, damn, I've got at least 15 of those things that she said on a list right now, right? What would be the best steps for that person to start their journey to getting this taken care of?
Yeah. So what I'm going to do is like create a doc with hyperlinks that you can share with this.
Oh, good.
But finding a Lyme literate doctor, so there's the iLads, that is a place where you can find a doctor like that. And really, as far as testing goes, GeneX or Vibrant Wellness, their tick-borne panel that's going to look for the Lyme and co-infections. Also making sure that mold is tested, that things like Epstein-Barr is tested, just to see where you're at. And really keeping in mind that as we kill things, parasites. So parasites don't just live in our gut. That's where like stool testing, just because no parasites showed up on your stool doesn't mean there's not parasites, but Lyme will hide in parasites too. And then we also have cavitations from where maybe we had our wisdom teeth removed, or we had to have a tooth pulled or a root canal, and the Lyme will hide in those cavitations as well. And so, if we're not addressing all the hiding places, and maybe you are doing better after doing a protocol for a while, but if then you end up 10 years later living in mold unknowingly, have a crazy virus, these different things, you might get hit again. And so we want to make sure to clear out all of its hiding places. Yeah. And keep in mind that treatment for this can be months to years. It's something that, you just have to be patient and gentle with your body, with yourself. It's, I'm definitely like one of those just get in there and get it done type personalities. And this has taught me that you can't do that. So that's where, I would start, is making sure that you find someone that knows what they're doing, that they also understand how these other things can play a role, like mold. Recently I went and saw a naturopathic doctor for my daughter, and I brought up mold and SIRS, and she was honest with me. She's like, I'm not really versed in that. And then just gave us a killing protocol. And I was like, that doesn't sit well with me, right? Like mold is something oftentimes needs to be addressed first before the Lyme because of how much it suppresses the immune system. And so making sure that you find someone that understands how all these things play together and the steps to address it, right? The proper steps. Because the thing that can happen if you were thrown into a killing protocol before your body is ready, and granted, there are periods of time, if it crazy active infection, you might need to do antibiotics at that time, to bring it down, because in certain individuals, some of these infections can cause death. And so that's how serious it is. And so the problem is if we get in there and start killing too fast, we can cause inflammation in the brain. We can cause a whole lot of different issues. And that's why I said it's important that we address that drainage first, right? That your gut, your liver, your kidneys, your lymphatic system, that those are supported before we go in and start killing, and making sure that we're feeding the body with nutrients that it needs to heal. I think that's oftentimes something we'll see, is where maybe someone goes on an elimination diet and they're really just focused on not eating the things that are, on the avoid list, but they're not pushing the nourishment and filling their bodies up with the healing foods. And so those are just, some things that I'd really want to make sure people consider.
Or the layers to this, right? I mean, it's intimidating, and I'm sure people who are listening with all the with major problems, it's intimidating, and I get it. I can get that. I mean, the whole cavitations thing. Oh my God, that's an exhausting topic. It's exhausting from two perspectives. It's exhausting in the sense that, in the way of describing something that's lengthy in explanation, right? But it's exhausting in the physical, just thinking about what I would have to go through, because it's so expensive. It's so incredibly expensive to take care of cavitations. But when I first found out about cavitations, which was only when I started working with the Pompa program, I knew nothing about cavitations until then. And now, after having done some deep dive into that, I'm like, oh my God. If you're not familiar with the topic of cavitations, I'm not going to get into it big here. At least at this point, we'll have to bring in a dentist or someone specialist to really go over that. But look up cavitations. One of the things that was scary with cavitations was just the list of things that can be found inside a cavitation: parasites, Lyme, staph infection, Campylobacter, just crazy stuff, just nasty stuff. The fact that could be hiding in a hole in my jaw, leaking toxins into my body, is horrifying. That's like, you can make a nice horror movie about that, put that out in Hollywood. That would scare the bejeebers out of so many people. I mean, that's crazy.
Right. And the thing that I like to compare cavitations with Lyme is making sure that you have the right specialist to do the test that knows how to interpret it.
That's a good point.
When and we'll leave the cavitation discussion for a biodentist, but I tell clients is, just because someone's a biological dentist doesn't mean they know how to interpret the cone beam scan appropriately to identify the infection in the jaw. And the worst thing that can happen, same with Lyme, because the testing false negative rates are about the same between the two of those, is to be told you don't have something, think you ruled it out, but it's actually there and majorly impacting your health. And so that's why it's important that you find a reputable doctor that specializes in these things, so that you can make sure that you are, checking all the boxes, essentially.
Yeah. And you said iLads, is that the organization?
Yeah.
So that's where you would go to find a Lyme doctor. And so like a biological dentist that's specifically trained for XYZ, this would be the same analogy you're saying. Yeah. Okay. And so first steps first, find you an iLad doctor. Now, is it also similar in the sense that you may not have anybody close to you?
I think so, but for this, I think where it would be different from a dentist, where you actually physically have to have work done, is that there are a lot of, doctors that work virtually, and you could go get your labs done. And
nice. Okay, nice. So you can just send your labs, and you don't have to go plan an entire vacation about going to another state or another country.
Right.
Yeah, very good. Yeah. Yeah, for those aren't familiar with cavitations, you may have to go to another state, you may have to go to another country, depending on cost and everything else, just to find people that are specialized in doing something like that. But that's good. The fact that you can just send the labs and have them analyze that and then let you know, at least then gives you the ammunition you need to start the process.
Right.
Yeah. And we talked about this at the very beginning. So how confident are you that if you sent these labs to these doctors, that you're going to get the right type of result? A confident result.
Right. So, the hope would be is that with getting a Lyme literate doctor, they're going to more be going off your symptom presentation, not with just the lab showing. So even if we did the functional test, right, that's doing the co-infections and not just looking for antibodies, but looking for DNA from these organisms, right? So kind of proof of life, is this thing in the body? They're more going to be inclined to listen to you, right? That's the difference too when you go to like a functional medicine doctor. Yes, insurance usually isn't covering it, but they usually spend an hour with you on your first appointment, 45 minutes after that. And so they are really listening to what's going on with you. What are you presenting with? Not where when you go to the medical doctor that your insurance takes and you get 10, if you're lucky, 15 minutes with them. And so, that's a big thing, is them really just hearing your story, hearing your symptoms, and really going from there.
Gotcha. Man, there's just so much. I hope that the information that we've presented here is going to be enough to help give people some ammunition. Because there's so many things out there, right? I mean, we could talk for hours and hours on so many different topics that are affecting people's health. Uh, Lyme is just one of many, but Lyme, like you said, you called it the great mimicker. Is that what you said?
Mm-hmm.
Yeah, I mean, the great mimicker. So, uh, you know, you really have to have a good person to help you through that pathway to make sure you're getting what you need to get done.
Yeah.
Yeah.
So that's why I won't see Lyme people, right? Like, because there are just so many different things that could be going on as we're finding a really great doctor. So like Dr. Bill Rawls, Dr. Richard Horowitz are some great resources. I don't know if Horowitz has had Lyme, but Rawls has. And so I feel like there's no better doctor than the one that's lived through what you're living through.
Yeah, that helps, doesn't it? Because it gives them the right perspective. Right.
Mm-hmm.
Well, so using the word perspective as a segue into kind of a final topic to kind of go over. This is we can relate this to Lyme, but I'm just curious too, because I know that you are, as I am, a huge Maha supporter and follower. So just give me a perspective from the alternative community. Okay. Um, what you think about what's happening with Maha, what they've done already, where it's going, the goods and bads, how it's going to affect our industry, just as a perspective. What do you?
I mean, part of me is optimistically hopeful that, we are seeing some changes, things come to pass. What's interesting though is the backlash already. Like,
Mhm.
God forbid we remove food color from your food when there is tons of scientific research on what these dyes do to the human body that aren't allowed in other countries, you know? And it's almost like now you have the conspiracy theorists on the other side. And we're doing all these things, but really when we look at this is to make America healthy. This is to care for the next generation. And even down to the vaccines. I mean, the science of a vaccine, I'm on board with. The things that they're putting into it, you tell me we can't make them safer? We can't remove some of these things that are triggering these responses? And so, it's like, oh, Kennedy's taking the vaccines away. Kennedy's taking the medications away. Kennedy's taking the chemicals out of our food. Where's that bad? And maybe it's because you don't understand that there is information on the harmful effects of each of these things. You're maybe not a family that's been impacted by it yet, right? Maybe you won't be. I mean, I'll tell you, I was raised by a nurse. My kids were vaccinated, right? And even after my son's vaccine injury, I didn't know it was a vaccine injury. The doctor hid it, put it in his file, didn't tell me.
Interesting. You've seen the file where the doctor actually put it in the file and didn't tell
So,
you. Interesting.
it wasn't until my son was 9 and, he was injured at 7. And I came across an article on the HPV vaccine injuring all these girls and hospitalization, death, all this stuff. And I was like, what? I thought they were safe, right? Because that's what we're told. They're safe and effective. And so at that point, we stopped. My son's going to be 21 this year and he's doing great. But, we had moved to Oregon. The minute we moved back, because we moved back to where we were from for a year before we came to Tennessee, the week I got back, I went over to the doctor's office and I want a copy of all of my son's records. Because at that point, I had learned a lot and I knew what happened and I knew what I was looking for. And so all they did was give me his well visit checks. I was like, no, every piece of paper that doctor wrote on, I want a copy of. And so I'm going through, I knew the time frame and I get to it and he wrote serum sickness on it.
Interesting.
I'm like, mofo, so you knew what happened to my son. If I would have known, obviously I would be like, well, I'm not going to give my kid another vaccine then. And just didn't say anything. Sent me to a GI in Encino, and that was it. And, so I think that's the hard part, is that, we're led to believe that these certain things don't affect us, right? And I would say indoctrinated, right, as the American population, that these are safe and effective, that what you eat doesn't matter, that these chemicals and additives don't hurt you. But really, there's tons of research that these things do. And so I am hopeful that Kennedy is going to be able to turn some things around. Just because, I'm sure you see it. Just going to the grocery store, you see these kids and they look sick already. They got the circles under their eyes. You can see the inflammation, and the parents have no idea.
Well, it's 9 times out of 10, the parents look just like the kids.
Right.
Yeah.
Right. Or I'll see where the parents are eating healthy because they're trying to lose weight, and then their kids are still eating junk.
Yeah. I have people that I could list right now, exactly that. They eat really well. And it's also because sometimes it's just too much of an effort to try and get the kids to do it. So they will eventually catch on, right? So they eat healthy as adults, but the kids are still eating, chicken McNuggets and stuff, because that's just easier, because that's what the kid wants.
Right.
Yeah.
Right. So,
You know,
I took my kids through a version of AIP when I was going through it, because, we already knew that their health had been affected from the toxic mold. We didn't know about Lyme at this point. But, my son started making eye contact again and started allowing you to hug him again. And that was just with diet change. And my youngest, who had a lot of stimming issues and even head banging and had more severe, all the symptoms went away just with nutrition changes.
have you seen my interview with Ginger Taylor?
Mm-mm.
You need to watch that.
Okay.
Ginger is an OG in the health freedom movement. She's been around for quite a while. One of the old guard of women warriors in the movement of vaccines, and she very similar statements where went through all these experiments with food, and she didn't have your education on that, and she was doing it even a little more piecemeal, but the same types of results, so what we put in our bodies. The description I always give to people is, if you're going to build a house, you can only build the house as well as the materials that you're trying to build it with. So if I give you rotted wood and rusted nails, can you build a mansion? No, you're going to build a shack. And that's what you're doing with your body. If you're ingesting, the rotted wood, rusted metal, if that's what you're ingesting, then that's what the cells you're building. You're building those types of cells, and you can't create foundational health with cells that are starting from that standpoint. It's just not going to happen.
That's a great analogy.
And you mentioned some of the things with Maha. My big thing is, when you have people who are not even willing to have a conversation, that alone should tell you that there's a problem. If they're not even willing to have a conversation, which has been the case with vaccines since day one, oh, let's have a roundtable discussion. We'll have two panelists who can have these conversations and debate these things. Oh no, we can't debate, because if we debate, that gives validity to the other side. So they've avoided these conversations. And now with Kennedy in, you still have the same types of people who are the deniers, the ones who want to write articles in major publications about how the food dye is really not an issue, and make every single thing that he's working for as it's either overblown, right, or it's dangerous, as opposed to having a conversation. They just want to do that. And so that alone tells you that he's on the right track.
Right. Yeah. If you're getting opposition, you're definitely on the right track. Even when you look at who you're taking your health advice from.
Oh, yes.
Do they look healthy? Look at Kennedy. What is he, like 68? Dude.
Oh, no, he's in his 70s. He's in his 70s. He's like 74.
Oh my gosh. Okay.
Yeah.
Yeah. Does not look like, right?
The guy looks fantastic, right?
So, obviously, if someone's they're not just talking a talk, they're walking it too, right?
Yeah.
They're walking the walk. Like, I'd rather take my advice from someone that's doing the things versus somebody that just does not look healthy.
Right.
So, yeah, there's a whole lot of things with that one. But and that's the thing, there needs to be able to be discussions and debate. And if we can't question something, that's a big problem.
Absolutely. Absolutely. If you can't even question something, the science has been settled. The stupidest comment ever made on the planet.
Science is
Uh,
never settled.
that's like antithetical to the concept of science. That is like so anti-science.
Wait, what's the
Science,
scientific method?
right? You have to create hypotheses to disprove these things, and you have to work to disprove it. You have to do that. And at no point are you like, okay, well, we've done 15 things that have said this, so we never have to look at that ever again. It's done, right? It's just done. The whole thing's crazy. It really is. So, Christian Allgood, do you have any other words of wisdom you want to impart here at the wrapping up point?
Not that I can think of. This has been a great conversation. I think just really making people understand that Lyme is not rare. It's underdiagnosed. It's misdiagnosed, right? And that is something huge. I mean, again, I have no idea how many doctors I saw over the years, specialists. Like, I had a couple neurologists, ophthalmologists, cardiologists, GI, like I had specialists, right? I saw naturopathic doctors. I saw some big name naturopathic doctors, and nobody thought to test, you know? And so if you're looking at some of these symptoms and you're like, they keep telling me all my tests are negative, but some of these symptoms are sounding familiar, get tested.
Get tested. Get
Doesn't
tested.
matter if you don't remember being bit by a tick. A tick, you don't have to find a tick embedded in you. You know, when we talk about transmission, there's a lot of variables there.
Yeah, what you talked about with sexual transmission, I had never heard that before. And I forgot to say, yeah, just like 2 months ago, I was in conversations with you through emails trying to get this set up. And we at the time had 3 dogs. One of them just passed away. I know, 15 years old, lymphoma. But I was walking our littlest dog out to take her outside, and I reached down and scratched my arm, and I felt something, and I looked down. I didn't have my glasses on, and it was a black bump. And so I put my glasses on. I'm like, mother, and it was a tick. It was a tick, and it was the first tick I'd had on me since I was a kid. It was on there. It was only on there for a brief moment, and I was able to knock it off without any effort. So I don't think it even really got a good latch on me. But that freaked me out. So, because I had Lyme in my head too, because I knew we were going to be having this conversation.
Yeah. Yeah.
Well, I want to show quickly here, and I'm going to list these things for everyone to see, but here is your Instagram page.
Oh, thank
So
you.
you can follow Christian on Instagram at Christian Allgood. You can also find her on Facebook under the same name. And you can also go to her website, so allgoodholisticwellness.com, where there's also a blog as well. So I will make sure that these are all, well, that's not for anybody to see. That was my email, so we don't want that up there. But I will make sure those are all listed for everybody as well. So Christian Allgood, thank you so much for being on the Flipside. You've been wonderful. It was a great conversation.
Thank you so much for having me. This was fun.
And I think what I just did is I may have just knocked out the try speaking again.
Hello.
There it is. Okay. I must have clicked something when I got off there because it muted you temporarily. So thank you so much for being my guest on the Flipside. And for all of you out there watching, I will see you on the Flipside. Bye-bye.